Welcome to Global Update. This is the show where we try to understand what life is like on the ground in places in the world that we might never be able to visit, or what's happening to people that we will never be able to meet. Our goal here is to feel a bit more connected. We'll have stories from all 7 continents. All right, today we're starting in North America, specifically Staten Island, where there's a story about Amazon, provided by Democracy Now!, that Amazon planned a smear campaign against a strike leader who demanded coronavirus protections. So it looks like there was a PR campaign to smear fired employee Christian Smalls after he led a strike at a Staten Island Amazon warehouse demanding sanitized workspaces, protective masks, and COVID-19 tests for workers. That all makes a lot of sense. I think we'd want those for them. At a meeting attended by multi-billionaire Jeff Bezos this week, it looks like they declared Smalls the man not smart or articulate, and outlined an anti-union campaign with Smalls as the face of the entire union/organizing movement. So it looks like that, and there already have been many Amazon centers that have been tested positive, for the coronavirus. So it looks like there is a genuine threat that the coronavirus is kind of spreading quickly within these workspaces, and if there's no protections, they're gonna be bringing that back to their families, and that is really disheartening. This kind of goes along with the trend of Amazon to treat their workers, especially in the warehouses, pretty poorly, and trying to basically cut corners and make sure that they can provide as little as possible, to spend as little as possible on these workers. So they have a history of overworking the workers, not providing breaks. So just kind of trying to extract as much productivity as possible out of them. And then also, they just have this history of cutting corners with taxes as well. Anything that kind of benefits the working people, and specifically their workers who are working people, is just they're trying to extract as much profit as possible, which works because their CEO is the richest man in the world, Jeff Bezos, with $150 billion. So it's really disheartening to see that they're not even investing in basic safety precautions because they're looking to maximize productivity. That really is the bottom line here. So it's disheartening, but hopefully the strikes continue and we see results from those. Okay, now we jump to Asia, specifically India. Democracy Now! Reports that they have implemented social distancing on 1.3 billion people, which, as you can kind of suspect, is pretty crazy because over 80% of India's workforce is informal, with most living off of daily wages, often less than $2 or $3 a day, wages they cannot earn under the present curfew, and more than 4 million Indians are homeless. So this is really worrying because a lot of them with the shutdown are trying to get home, and that can actually be really dangerous as well. People are dying on the way when traveling across the country to get home, and there's also insane police brutality. If you watch some of the videos from India right now, the police brutality is awful. A lot of times the worst violence is committed against migrant workers, because it tends to be a trend that when you're not part of a state, or if you are from a different country and you're in there, suddenly all your rights don't exist. So there's insane police brutality against people to keep them indoors when they are desperate for food. Some people quote, there's a man in a video, he's a man that is struggling to find enough food and money and things like that in the video, and he says that he would rather die of the coronavirus than die of starvation, which is what's happening. So people are dying of starvation there. Really sad. We jump now to Colombia, actually, a place that I was actually just there 2 weeks ago. But this is about the Venezuelans in Colombia, because they're not being treated very well. They have sort of less rights and there's a bit of discrimination, but it's being heightened because of this quarantine. For example, a lot of them live off of sort of informal economy, just like India, where you're selling food day to day to try to survive. So, for example, Brian Romero, he was unable to pay his daily rent of $3 in a hostel he was sort of renting in Bogota. And he uses a walker due to his paralyzed legs. He arrived 2 years ago from Venezuela. He sells biscuits on the street. And while days were hard, he was able to make enough to pay his rent and put food on the table. But the thing is, with this quarantine, Romero and many others are not able to do what they normally do to pay their rent and, support themselves because of this quarantine. So as a result, his landlady kept his phone because he wasn't able to pay his last rent. And that's one example. And she could kick him out at any second, which is really scary for people and families. If families get kicked out on the streets, that is really dangerous. For example, there is another family, Millicent Solana, 39 years old. She's from Venezuela. She sells coffee and empanadas in Bogota. And when the quarantine began, it became impossible. So she said, quote, "It's really hard because what we earn on a daily basis is what we live off of. It's becoming impossible." So they are making face masks for themselves. They have 2 kids, and she can't justify spending the 50 cents on the mask because they simply don't have enough money. So it's a really bad situation. And also prices are going up drastically in Colombia. So that's going to hurt the bottom line. It's going to hurt a lot of people at the bottom. So that's difficult. This is all provided by Al Jazeera, that article. So in Europe, Greece quarantines a refugee camp. 20 refugees test positive for COVID-19, which we know means there are a lot more cases than just 20 because these are crowded refugee camps. And if a few people have COVID, it's likely that many do. Refugees in camps are at high risk of acquiring infectious diseases due to crowded conditions with poor hygiene and sanitation. According to an Greek academic calling for the evacuation of Moria, Greece's notoriously overcrowded camp on Lesbos Island. So it is very likely the refugees will become infected with the virus in host communities or in hospitals. An uncontrolled spread in camp contexts such as those on the Greek islands may lead to a public health disaster, as measures of social distancing and quarantine are impossible in these settings. Now, it seems like the response is that Greece's Ministry of Migration has offered a series of what they say are preventative measures. These include effective lockdowns of the island camps in Moria. Only 100 people an hour are permitted to leave. Any remaining NGOs have to submit a list of staff who will be working in the camp. So it's good that there are people from nonprofits working within the camp to try to improve the situation. The bad news is that it's going to spread insanely fast, and there's no way to prevent it with the crowded camps. There's no way to prevent the spreading, and it's going to be a tough reality in the coming months or years. We jump now to Africa, and actually this is an uplifting story about Senegal. According to BBC, Senegal leads African fight against the virus. So the mantra of the World Health Organization is test, test, test. But Africa can ill afford expensive, time-consuming testing. So Senegal is working with a British company to develop a quick, simple $1 test. And more controversially, Senegal has been pioneering the use of anti-malarial chloroquine to treat coronavirus patients. So the WHO says its effectiveness has not been established, and other medical institutions have warned against the hype surrounding the drug. But Senegalese government spokesman Abdou Latif Kulalbi told the BBC that doctors in the country have seen a rapid improvement in patients treated with chloroquine. The WHO is not going to tell us what to do, he insisted. Our doctors can do what they want. With nearly 8,000 confirmed cases across the continent, Africa has not been hit as hard as other places so far, but there are fears that if and when COVID-19 takes hold, it'll be a catastrophe. Initiatives such as the cheap test Senegal is developing will be essential in saving lives on a continent with weak healthcare and sanitation systems, and where people are often vulnerable because of underlying conditions such as malnutrition, tuberculosis, and HIV/AIDS. I think the best thing we can do in this situation is hope that there's infrastructure from previous breakouts, previous diseases and viruses in Africa that things can be learned from. For example, in Senegal, if they have infrastructure and things they've learned from previous things, they can use that for COVID-19 and address it head on. But that is really the best we can do, and also hoping that many NGOs and organizations are sending as many people as possible. We jump now to one of the last continents, Australia. But we're not looking at the country Australia, we're actually looking at New Zealand, which is part of the continent. New Zealand is actually some good news. There's some good news coming out there surrounding COVID-19. It looks like they have hit their peak and they might be coming down. According to the Director General of Health, there's a quote, it may well be that COVID-19 is peaking now because we're seeing it flattening off. Now, this doesn't rule off that there could be another spike in the future. That's the case of any country. But a new health notice has been issued, leaving no doubt about what Kiwis can and cannot do in lockdown, as top officials are today expected to announce that New Zealand has surpassed 1,000 confirmed cases and probable cases of COVID-19. That's not a whole lot, considering my state of Washington has well over 2,000, probably more at this point. But it is definitely encouraging signs for New Zealand, a nation that is now on to its 11th day of lockdown, with at least 3 more weeks to go. So, yeah, we're hoping that they get to see, we want to see more countries that have that the cases diminish and they stay that way. Hopefully that there aren't more spikes, but we can only hope. All right, our last continent, I'm going to leave you with sort of a depressing story, but it is necessary to hear. This is according to the Independent surrounding Antarctica. So it says, we'd never seen a temperature this high. The 20 Celsius mark exceeded in Antarctica for the first time. The measurement was made on the 9th of February by Brazilian scientists at a monitoring station on Seymour Island, situated off of the coast of the Antarctic Peninsula. So this is the second time in 1 week that a record temperature has been set for the region. It's not good. So they say we can't use this to anticipate climate changes in the future. It's a data point. It's simply a signal that something different is happening in that area. The thing is, they also say we have climatic changes in the atmosphere, which is closely related to changes in permafrost and the ocean. The whole thing is very interrelated. Last month was also Antarctica's warmest January on record. The region stores about 70% of the world's fresh air in the form of snow and ice. Sea levels would rise by 50 to 60 meters if it were all to melt, according to scientists. That's definitely worrying. All right, so that was our last story for today. And I want to thank you for listening, mostly because if we all sort of take time to become informed globally and to work on being aware of how other people live, it can really help to bridge gaps of misunderstanding and help to create a better world, in my opinion. So thank you so much for listening, and we'll see you next time on Global Update.